Hey teams, Lauren and Rebecca here with Bizrok. In this week's video, we want to talk to you about something super important when it comes to treatment planning, which is treatment planning for the full mouth versus a single quadrant at a time. Rebecca, you get a lot of conversations about this when it comes to our practices. Can you kind of jump in and share with us?
I can. When a patient comes in and they are having a toothache on number 3, we'll just use that as an example. A lot of times what happens is we get the patient back, we should take the PA and a bite wing and an intraoral of number 3. But what happens is when we actually start treatment planning, we do not take a quick look around at the full mouth. It is great to actually focus on the area that is bothering them at the time, but it's actually a disservice to the patient.
I'm so glad that you said that. It's tough to say that sometimes, right?
It is.
But the reality is they probably have a lot of other things going on.
Right. I always think of it, if it was myself and I needed, we're going to say they needed a root canal, build-up, and crown on number 3. That is great. We can actually start with a root canal and get that completed and do the build-up. Hold off for a moment on the crown to make sure we do not need to do any other treatment that's going to be major treatment that may actually have that treatment change in the long run. Because who likes to cut off a new beautiful crown that we just seated?
Yes. Well, and that's why it's so important to bring them back and to educate the patient. Like, look, we need to make sure that there's nothing else going on. Let's bring you back in. And now you guys can give them that amazing, exceptional service and great experience whenever they walk in the door. And now you can actually have a comprehensive exam and treatment plan their entire mouth, right?
You can. And it goes back to a previous video. If you've watched all of our other videos, we have one that speaks about our 3 questions and actually going a little bit more in depth and asking about a budget. So if we know that when we're treatment planning, even if it's for a limited exam, we kind of know what to gear their full mouth exam to next time they come into the practice.
Yeah, guys, it's always about the patient, and it's trying to think a few steps ahead, even if they're just in for that one thing, right? So you got to be proactive. You got to pre-plan and make sure that you're using proper verbiage to educate your patient to come back to see you guys, right? So if you need any help, if you're like, okay, how do I role play this in my office, or I'm getting stuck here, wherever it is, guys, reach out to us. We'd love to help you. We'd love to support you, but make sure that you're treatment planning your patients and doing the best thing for them, which is doing their full mouth all the time, right?
Absolutely. Just make sure we're looking at it as a whole, not just that one specific area.
Awesome. If you need anything, guys, reach out to us. Otherwise, we can't wait to see you and serve you soon.